Chair, RB, this year BMA asked doctors in Northern Ireland about their working lives. The findings have been revealing. Doctors feel under pressure in a way that I don't think they've ever felt before. There's a profound shortage of doctors in many areas in both primary and secondary care. We're working in an environment with increasing pressures and insufficient resources. It's directly impacting on our morale. 70% of consultants we surveyed told us that their morale was either low or worse. Over half felt control over how they work has decreased in the last 5 years. 43% of junior doctors said they had long-term gaps in their rotas. 4 out of 5 doctors in Northern Ireland said they didn't have enough time for learning and development. All of our surveys indicate that our doctors have workloads that prevent them having a proper work-life balance. And what is the result? 60% of doctors who replied thought there were actually better opportunities to work as a doctor outside Northern Ireland. This must be reversed. And what needs to change? Well, we need long-term recurrent funding for our health service to match the increasing demand. We need to transform how elective care is provided in order to reduce unacceptable waiting lists that patients currently face and the pressures that this then puts on doctors. We need a local assembly and a local health minister. Over 500 days without a government is too long. The new workforce strategy developed by the Department of Health with input from the BMA has the potential to improve the working lives of doctors in Northern Ireland. And we welcome this strategy and look forward to it being fully implemented. The past year has seen the release of the report into the O'Hara inquiry into the tragic deaths of 5 children in Northern Ireland from hyponatremia. And the report raised serious questions about the governance of healthcare in Northern Ireland in the late 1990s and early 2000s. It revealed a system which was closed and slow to admit mistakes. In the present day, in the current pressurised working environment, our survey suggests that nearly half of doctors from Northern Ireland often worry about making a mistake. So this too must change. Our working environment must become one which is fully responsive to doctors raising safety concerns. An open learning culture where if a mistake occurs, we can all learn so that safety improves. The O'Hara report proposed that foundation year doctors should no longer work on children's wards. This would be a retrograde step. If we exclude junior doctors from the earliest stages of training in paediatrics, how will this specialty be maintained? Paediatrics is a specialty in Northern Ireland which already has significant difficulties in recruiting. 10% of our training posts for future consultants are not being filled. We want to encourage, not discourage, doctors to specialise in the care of children. The key is appropriate supervision of doctors in training, not a ban on participation. This year, we've had successes. After extensive lobbying, we've been successful in securing funding for SAS doctor development. So this will mean, for the first time, an essential and overlooked part of our workforce will be able to access funded training and development. Well done to Dr. Kearns and the Northern Ireland SAS Committee for persevering with this goal. After many years of underinvestment, progress has been made in general practice with a practice pharmacist scheme and plans for new multidisciplinary teams. Led by Molly Kerr, our prior medical students chair, our work on widening participation in medicine has expanded. Our medical students have volunteered to work with individual schools to encourage more young people into medicine, but particularly those from less well-off backgrounds. We've also begun to work across all branches of practice to look at the issues faced by women doctors in advancing their careers. As I conclude, I'd like to thank our National Director, Claire Armstrong, and her team in Belfast for all the work they continue to do on our behalf, and I hope that you will join me in applauding our successes and all the work of the BMA staff in Northern Ireland.